Okay, for Unit 3 for AP2, we are going to be going through two systems. First one's going to be the respiratory system. The second is going to be the digestive. So we're going to start with the respiratory system. So we have two major regions when it comes to our respiratory system. We have the upper respiratory system or respiratory tract and the lower respiratory tract. Upper respiratory tract is pretty much everything above your trachea. So we're talking about the external nose, the nasal cavity, the pharynx, which is basically the connecting point between your nose, your mouth, and your throat. It starts up here, right behind the nose, then continues behind the mouth, and then right here in the upper throat, followed by the larynx. Now, for me personally, when I was a student, I was learning this, I used to get the pharynx and the larynx fairly confused. The larynx is the voice box. So now I think of somebody going la, 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 nobody goes fa, 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 and if they do, that's weird. So larynx is the voice box, okay? So there's the larynx. You can actually see the vocal cords. Now, that's all upper, okay? Lower, you've got the trachea. These branches that are going into the lungs are the bronchi, and the bronchi split multiple times. So, looking really closely at our upper respiratory system, you've got the skull, okay? The cribriform plate, which is that plate in the ethmoid bone, is actually the ceiling for our nasal cavity. You've got sinuses, the sphenoidal sinus and the frontal sinus. The thing about how we breathe the air, we have to moisturize that air before it actually goes into our lungs, or our lungs would dry out. So you've got these spaces that not only moisturize because they're surrounded by mucosal tissue, but they warm the air so that it doesn't go down into your body cold, meaning that it could potentially lower your body temperature. Instead, it swirls around, gets warmed up, and gets moisturized, gets, moisture in it. So, inside of your nasal cavity, you actually have these structures, and if you think back to AP1, you'll remember these structures, the concha. Now, a conch shell is the one that spirals, okay? So these concha, here's the wall of your nasal cavity, actually come out and look like this. They're curled over like this, okay? As you breathe in, the air coming in doesn't just go straight in. When it hits those concha, it causes it to spin, and that spinning actually exposes the air more to the surface of your nasal cavity. By doing that, it again warms it up and it moisturizes it. Think about it for a second. When you, lack of a better way to put it, have a sharp booger, your nose, bleeds like that, right? One of the reasons is because right next to the surface on the inside of your nasal cavity, you've got a ton of blood vessels. And the reason that you've got those blood vessels is to help to warm the air. As well, it's covered in mucus. So again, we get that moisturizing. So these concha coming out like that are creating kind of that whirlwind effect anytime we breathe in. Under the concha, there's kind of that fold, that space that's under the actual overhang. These are called the meatus. And again, we've got a superior meatus, a middle meatus, and an inferior meatus. The concha, superior, middle, inferior, okay? So they kind of match up, all right? Your nose itself, if you pay attention, there's a part of your nose that sticks out further than your face, right? That little area that sticks out further than your face could be considered the entryway into the nose, right? So we call it the vestibule. Vestibule means the entry. The holes that we can call nostrils, they're actually called the nares, okay, or the nares, depending on how you learned it. Now, the hard palate, the maxilla in your skull, makes up the base of this nasal cavity, but at the same time, it also makes up the roof of the oral cavity, okay? You can breathe through your nose, but you can also breathe through your mouth. So that's one of the reasons why we're including that, okay? As you come back, you will notice that there's kind of that little area right before you get to the pharynx, the throat. This is called the choana, okay? So you've got the meatus and then that choana, that area that's right before you get to the throat. You can also see this drain here, this hole. This is actually the opening to the auditory tube. So your ears, if you think back to the special senses, we had the eustachian tube that drained. That's actually where it drains to, okay? You can call it the auditory tube, you can call it the eustachian tube, either way is fine, but it is actually where that tube is going to release pressure and to, if there's any fluid in there, release that fluid. So this is where doctors put tubes in your ears. So with kids who have constant ear infections, one of the reasons that that's happening, this should be at an angle like this. Your eustachian tube should be at an angle like this so that it drains. With kids, sometimes they're more like this, so they're not draining. So fluid builds up in there and then you get infection. So they put tubes in there to keep them open so that they'll drain properly. Okay. Let's see. Don't worry about the pharyngeal sinus. I'm not worried about that. So, back of the nose, here's that tubing. Back of the nose, back of the mouth, top of the throat. Okay? This is the pharynx. This is that top piece of that tubing. At the very top, right behind my nose, I have the nasopharynx. Okay? Right at the back of my mouth, here's my mouth, I have the oropharynx. Okay? And then right before I actually get to here where my vocal cords are, my larynx is, I have the laryngeal pharynx, okay? The little dangly thing at the back of your throat, that's the uvula. And basically, again, you know how this choana is basically that transition from nasal cavity to pharynx? In the mouth, you have the fauces. That's, again, kind of that transitional space between where your mouth is and where the oropharynx is. In the mouth, you have the tongue, okay? Now, I know it's not as exciting, I guess, as with the nose and the concha and all of that, but your mouth does have saliva in it, and it is a warm space. So even when you're breathing through your mouth, you're still moisturizing that air, and you're still warming it up before it goes down into your lungs. If you've ever lived in a really, really cold place, when I lived up in Cleveland, Ohio, it was, we'd have days where it was 17 below zero. It was freezing and it's snow and everything else. When you breathe in cold air like that and there isn't enough time to warm it, it is painful. It's painful to breathe. It's one of the reasons why when you see people up north and they're in the snow, they tend to have a scarf wrapped around their face. It helps to kind of keep the air moving more slowly. And as you breathe, you warm up the scarf. So not only are you breathing through your mouth and your nose, you're breathing through the scarf, and that's helping to kind of warm that air and moisturize it as well. Okay, so we've got the pharynx, the uvula, the fossa. Again, don't worry about the tonsils. I'm not worried about the tonsils. Coming down, here is the hyoid bone. Now you might be going, okay, why are we mentioning the hyoid bone now? Because believe it or not, that bone helps to keep your breathing tube stable. Bone is a fairly, rigid structure, right? And if you think about it, when you're breathing, let's say I take a deep breath really fast, right? I'm changing pressure in that tube really, really quickly. it's kind of akin to going to Whataburger and getting a chocolate shake. That shake is going to be thick, right? So if I get the straw and I go, what's going to happen? Eventually, I'm going to suck the air out and the straw is going to go and seal, right? I don't want that happening with my breathing tube. It's a bad idea. I've got mucus that is already sticky on the sides of that tube. So if I do that and it sticks, it's not coming back out. So what do? Well, I frame it up. The first thing that I put is that hyoid bone. When I do that, that hyoid bone goes, but it doesn't actually collapse all the way. If you've ever watched like murder mystery movies where somebody's been strangled, a lot of times they'll talk about the fact that the hyoid bone was crushed, it was broken. And the reason is because they put so much pressure that it actually gave way. So you've got the hyoid here. See this little flap right here? This is the epiglottis. The epiglottis is what folds over when you're eating to basically block this tube from food going into it. Does it always work? No. How do I know? People choke, including me, most of the time on nothing. So yeah. So as you come basically from hyoid bone back here to the epiglottis, now we're talking about the larynx. We're talking about the voice box. So you've got pieces of cartilage and that hyoid bone that are all responsible for basically giving you framing to make sure that it doesn't collapse. So you can see here, you've got the vestibular fold, you've got the vocal fold, and this chunk of cartilage right here is the thyroid cartilage. In men, this is what becomes the Adam's apple, because in men, this really thickens up after they go through puberty, and that's why their voice drops. Like a guitar string, if you've got a guitar string and you loosen it, it goes lower in pitch, right? The more loose you make it, the lower it goes. Well, when they thicken that thyroid cartilage up for the Adam's apple, it makes the vocal cords slightly looser, so it makes their voice go down. Women have thyroid cartilage. They do not have Adam's apples. If you've got an Adam's apple, something sticking out like that, you need to go to a doctor because it's not a good thing. For women, we do have a slight change in our voice, but it isn't a big enough change in our voice to cause that change in pitch that is so obvious in men. Yes, our voice changes slightly, but it's not the same. So you've got the thyroid cartilage right here, which you will see in a better viewpoint in a bit. Then at the base here, so here's my larynx, right? At the very base, there's another big piece of cartilage called the cricoid cartilage, okay? So as we go past the cricoid cartilage, see all of these little pieces of cartilage? That's the trachea. That's our breathing tube. This is where air moves. There's another tube back here, but it kind of looks like it's a deflated balloon. That is going to be the esophagus. So again, just kind of taking a look, we've got the cribriform plate, the frontal sinus, the sphenoidal sinus, the superior concha, followed by the superior meatus, the middle concha, followed by the middle meatus, the fold, the inferior concha, the little sticky outy part, the inferior meatus, the vestibule, which is the entrance, the nares, which are the nostrils, and then that transition from your nasal cavity back to the pharynx is going to be the choana. Okay? Okay. Again, mouth area, you've got the hard palate, which is the floor of my nasal cavity, but the roof of my oral cavity. You've got the oral cavity itself, the tongue. Don't worry about the tonsils, the hyoid bone. The opening to the auditory tube, nasopharynx right behind the nasal cavity, the soft palate with the uvula, the little dangly thing at the back of your throat, the oropharynx right behind the mouth, and the laryngopharynx right below the oropharynx. Wrong computer. Hyoid bone, epiglottis, thyroid cartilage, cricoid cartilage, vocal fold, vestibular fold, vocal fold. The esophagus is the deflated balloon, and then the trachea is the white tube in front of that. A little bit closer. Vestibular fold is above that, vocal fold is below that. Wow, the thyroid cartilage is not pointed out correctly. That's the thyroid cartilage. Epiglottis is way the heck up here. Cricoid cartilage, esophagus, trachea. I'll fix that. Looking at the model of this, there's the frontal sinus right there. And it's literally right here in front of your head, so you can't really miss it. You've got the superior concha, the superior meatus. The middle concha, the middle meatus. The inferior concha, the inferior meatus. Here's the nose, that's the entrance, that's the vestibule. The external nares, the nostril. You've got, excuse me, the sphenoidal sinus, okay, it's number 54. The hard palate, which again is the floor of my nasal cavity, the roof of my oral cavity. Here's the tongue, there's that soft palate. Can't see, too close. That should say choana. That's going to be the entrance of the auditory tube. That is the nasopharynx. Okay, I'm gonna pause for a sec. Okay, that's better. So we've got the choana, the drain to the auditory tube, and the nasopharynx is number 65, okay? So let's go with the larynx. So this is the isolated larynx, okay? This is the anterior view, so you're looking at it here. This is the posterior view, so you're looking at it from back here. And then this is the medial view. So if you cut me into right and left halves, you're looking at it this way from the middle, okay? So here's that hyoid bone at the top, okay? You got that U shape with the little horns. You've got the thyroid membrane. Here's the thyroid cartilage, okay? It kind of looks like a butterfly. You've got the cricothyroid ligament. There's the cricoid cartilage. So pretty much here to here, that's going to be your larynx, okay? Trachea has these C-shaped rings of cartilage. So the cricoid cartilage does not have that same shape. You know the difference between the cricoid and the tracheal cartilage because it doesn't have that perfect, almost looks like a circle shape to it. And then you've got the membrane between the tracheal cartilage rings. Looking at it, and the epiglottis. This is that fold that comes down when you're swallowing. So looking at it from the back, so you're looking at it this way. Here's that epiglottis that folds over, okay? Here's the hyoid bone. Here's that cricoid cartilage. Remember I said it's a big piece of cartilage? That's the back of the thyroid cartilage. So it basically is wrapping around like this. So you're seeing that wrap around like that. The quadrangular membrane actually has two little pieces of cartilage inside called the cuneiform cartilage. And then here, you've got the arytenoid cartilage. These actually corniculate cartilage, arytenoid cartilage. They're involved with the control of the tension in your vocal cords, okay? I don't know why that's there. That's weird. Anyway, as you can see, those C-shaped rings of cartilage don't go all the way around the trachea. You can still see it, but it's not sealing this off, okay? And then you've got the membranes. Now, why? Why is that important? Well, you have to remember that the esophagus, your eating tube, is right behind it. Now, when you're not eating, when nothing is going down that tube, it's like a deflated balloon. There's nothing in it. But when you do swallow food, it needs to be able to expand. If you've got those chunks of cartilage all circular all the way down, when you swallow, it'll shift your trachea forward. Now, I know everybody has had that one like piece of meat or something that you swallowed thinking, I can get this down, and then it hurt all the way down. One, you were stretching out your esophagus, which wasn't a pleasant experience. But two, because of how big that was, it did cause your trachea to shift forward. Again, not a pleasant sensation. Now, medially. So pretend I cut this water bottle in half and this part is down and you're looking from the middle, okay? So again, you've got the epiglottis. There's the cut in half hyoid bone, and you can see it curling around this way. The thyrohyoid membrane, your thyroid membrane, and here's your thyroid cartilage, again, coming around, and you can see the end of it here. It doesn't completely surround it. Here's the cuneiform cartilage, the corniculate cartilage, and the arytenoid cartilage. So here are those vocal folds. So again, voice box, okay? There's your cricoid cartilage at the base. So you've got the vestibular fold on top, the vocal fold at the bottom, okay? This piece of ligament between my thyroid cartilage and my cricoid cartilage, cricothyroid ligament, and then you've got the tracheal cartilage right here. So your vocal cords are anchored to the arytenoid cartilage, okay? So when we make our voice go high or make our voice go low, it's literally based on how tightly we are yanking those vocal cords, okay? So let's look at the larynx model. Hang on. Yeah, okay. So this is the larynx off of our respiratory system model. And you can see the hyoid bone, the thyrohyoid membrane, that piece of tissue between my hyoid bone and my thyroid cartilage. This is the thyroid cartilage. It kind of looks like two butterfly wings. Well, that notch in between the butterfly wings is actually called the superior thyroid notch. Here's my cricoid cartilage. So there's the cricothyroid ligament that holds the thyroid and the cricoid cartilage together. There's my cricotracheal ligament between my cricoid cartilage and my tracheal cartilage. Okay, and the minute you start seeing the rings after the cricoid cartilage, this is the trachea. Now looking at the other side, I have several muscles. I've got the Thyrohyoid muscle. This is better in the other picture that I will show you, but there's actually, this is coming here, there's another muscle right there. It's called the inferior constrictor of the pharynx. The cricothyroid muscle, again, it makes sense. Here's the cricoid cartilage, here's the thyroid. And then this here is actually the thyroid, which you know is that butterfly-shaped thing right next to our voice box, right in front of it. So looking at another model, again, larynx. You've got the hyoid bone. That's the epiglottis that folds down. You've got the thyrohyoid muscle. You've got the cricothyroid muscle. You've got the cricoid cartilage at the base here. You've got the trachea. So, hang on one second. I want to get this model because that picture just doesn't do it justice. Okay. So there's the cricothyroid ligament, thyroid cartilage, cricoid cartilage, ligament in between. The cricotracheal ligament, because this is the trachea with the tracheal cartilage. Here, there are actually two muscles, the vertical cricothyroid muscle and the oblique. So when you look at the model from the side, you can actually see that there is one muscle here and one muscle here, okay? So the top muscle is the vertical cricothyroid muscle, that one there. And then this bottom one is actually the oblique, so that you can see that. Looking at it posteriorly, the other model, the lung model portion, you can again see the epiglottis, the arytenoid cartilage. Here is the transverse arytenoid muscle. Now, the inferior constrictor of the pharynx muscle, that's the one that I showed you on that other picture that you couldn't really see real well, but it's right there. The oblique arytenoid muscle and the posterior cricoarytenoid muscle. Now, you might be going, okay, what's the deal with all the muscles? Well, remember that, let's say you're choking, you need to make that tube smaller so that air moves faster to dislodge whatever's choking you. As well as the control of the tension in your vocal cords. So all of these muscles are basically helping you with that. So again with this model, okay? You looked at it this way from the front. There's that epiglottis. Now we're going to look at it this way from the back. Again, this is that folding over epiglottis. Okay? So you've got the epiglottis, the hyoid bone, the thyrohyoid muscle, which is the muscle that's connecting the thyroid cartilage to the hyoid bone. There's the arytenoid cartilage. There's the corniculate cartilage. This is the oblique arytenoid muscle. You'll notice that there's kind of an X here, and then under it is the transverse arytenoid muscle. So let me see if I can show you. See how there is an X of muscle on top of one that's just going right across, okay? The X is not going to be the transverse, it's going to be the oblique because it's at an angle. Whereas the one that's just going directly across is going to be the transverse because it just goes across. Okay, the posterior cricoarytenoid muscle, this is still the base of your voice box, so it's the cricoid cartilage. And then your trachea, you can see the cartilage, but there's nothing here because it's C-shaped cartilage. It's not completely around. Looking at it medially, the smaller version from the lung model. You've got the epiglottic cartilage, the laryngeal vestibule, the entrance to the larynx, the piriform recess, the vestibular fold, the ventricle of the larynx, the vocal fold, and then the infraglottic cavity below the glottis. The glottis is what we call the vocal cords because they can close. We call it the glottis. Now looking at, again, the bigger model from here. So here's the front. You're looking down into it, okay? Hyoid bone, there's that U-shape, epiglottis. Here is the vocal ligament. Here's the vocalis muscle. There we go. The thyroid cartilage. There's that arytenoid cartilage. And then these little cat ears on the end are the corniculate cartilage. And then you've got the lateral cricoarytenoid muscle. Why? Because it goes from the arytenoid cartilage to the cricoid cartilage. Okay? Now looking at the lungs. Actually, I'm going to take a breather and we'll come back.